Hello, I'm Dr. Dennis McKenna, as always joined by Dr. Fred Venditti, our hospital system general director. Today's Thursday, December 3rd, giving you the update from Albany Med. All right, we're going to jump into the numbers. First graph, here's the capital region, people admitted with COVID. Fred, 204. 204 is the number?
Pretty significant increase, Dennis.
You can see that slope clearly heading upward direction there.
Yes.
Next graph here is the medical center admissions and discharges. It looks similar to the last week or so where we see about 5 or 6 admissions per day, Fred?
That's right, Dennis.
Some days maybe even a little bit more than that.
Yes.
Yeah. When I looked at the numbers this morning, it appeared as though in the patients who are here, and let's get those numbers here. 66 in the house.
66 in the house.
7 in the ICU, 1 on a ventilator.
That's right.
When we look at that subset, 4 of them were under the age of 40, and I think we did have 1 child as well.
We did.
Yeah, okay.
So, periodically, we've begun to see some of the younger population come in.
Still no influenza activity here on the campus, at least as far as people being admitted to the hospital.
That's really good.
So, Fred, if you could make any predictions, if the admissions and discharges continued the way they did for the last week, we could be in the 70s next week?
We could, Dennis. I think the fly in the ointment of that, though, is Thanksgiving.
That's right.
The middle of next week will be prime time for the incubation of any exposures that people had, either traveling around Thanksgiving or even Thanksgiving meals.
Well, let's talk a little bit about more of that nationally. So here's a new graph. So if you take a look at this is people who are hospitalized. This is a national number.
That's right,
Dennis. And I think, Fred, you wanted to point this out a little bit.
So, Dennis, this is from the COVID tracking project. So this is online. You can find it. It's pretty easy to find. They pull data from all the states and verify. It's a pretty trusted source. And what you see here on this graphic are hospitalizations. The graphic goes back to the summer, the peak we had in the summer. And what you can see is yesterday we topped 100,000 patients in hospital across the country.
Right.
This is a pretty hard endpoint.
Right.
You could argue about the testing rate causing more cases, et cetera.
Right.
But these are people sick enough to get hospitalized. And I think, Dennis, this is pretty troubling. We nadirred in September, somewhere around 29,000, 30,000, and now we're up to 100,000. At the beginning of November, we were about 50,000.
Right.
We doubled over the month of November.
So you could imagine with that number of people in the hospital, one of the things that hospitals are looking at is PPE. It takes a lot of PPE to take care of that many patients. So it asks the question, how are we doing with our PPE?
When you're at 100,000 hospitalizations and rising, you're consuming all kinds of resources. So we hear a lot about the stress on staff,
right.
But it also is stressing the supply of PPE. So Dennis, we've sort of anticipated this. So through the fall, we've been very careful about how we've used our PPE, including things that we've been criticized for, which is trying to reprocess and reuse N95 masks.
Which is a CDC option.
We do it based on CDC guidance and with the full knowledge of the Department of Health here in New York State, and with lots of other hospitals doing the same thing.
Right. If I'm not mistaken, not all the hospitals in New York State have the 90-day supply of PPE that they're expected to. Do we?
We do, Dennis, and as a matter of fact, yesterday letters went out to, I think, 100 hospitals around the state, noticing them that they don't have the required level of PPE and threatening to fine them if they didn't.
And we did not receive such a letter?
We did not receive such a letter. We just know that because of the hospital associations.
So as we look at the numbers, we can imagine they'll continue to go up. It's good to know that we have enough PPE not only to care for people today, but if the number continues to go up, care for them in the future. That's why we've been doing what we've been doing.
Dennis, when I look at that graphic and I realize that the number of hospitalized patients doubled in 1 month, if that were to happen in the month of December, that means 200,000 people in the United States in hospital. That's just, it's a number that's just incredible to me.
Continuing on that theme, a couple messengers went out today to our workforce, a couple themes. Let's hit on them. One of the topics was wearing of masks by patients.
That's right.
Specifically, what did that say?
Patients who are in semi-private rooms When they're able to tolerate
Right.
it, we want them to wear masks.
Right.
And when they're in private rooms, when someone comes in, we would like them to put masks on. And Dennis, we changed that policy, I think about 10 days ago.
Correct.
So we're re-emphasizing that.
Another one we want to re-emphasize is protection of the mucous membranes around the eyes. We have various different ways to do that, goggles being one, face shields being another. Is there a preferred way to protect the mucous membranes if you're caring for COVID patients?
So Dennis, we'd like people to use face shields.
Face shields.
Because face shields cover the mask and will
Right.
prevent droplets from getting on the mask. And you could imagine, when you take your mask
Right.
off, you could contaminate yourself. So that face shield will help to
And
prevent that.
If I'm not mistaken, last time we talked about this, we said that we had 55,000 face shields, and I think that number probably continues to be as high.
It is, Dennis. They're
Right.
reusable. They
Right.
can be cleaned. They can be wiped off carefully so you don't contaminate yourself. But they are the preferred method, and that's what's in the messenger, preferred method for eye protection.
Another topic, visitation. Now, we are people who have said in the past that if you can allow patients to have visitors in the hospital safely, that's obviously preferable. But currently, that situation does not allow it.
That's right.
Visitation for patients, visitation for staff, it's really the same thing, correct?
It is. So there's a reminder that went out this afternoon that we have restricted visitation, and that does apply to our staff. So if you're not working or here for a medical visit, an appointment, something of that nature, we don't want you to come into the hospital. And it's really about limiting the foot traffic in the hospital and the potential for exposures.
Okay, very important messages. Last topic about COVID. Fred, people will recall back in the beginning days, March, April, we were taking patients from New York City when they had run out of capacity to care for them. The term that could be used is we were helping load balance, if you would, the care delivery across the state. Recently, the governor has been talking about load balancing again. It could be done by a region, it could be done by a health system, it could be done a couple different ways. Are we thinking about that?
We absolutely are, Dennis. So we're a network of 4 hospitals.
Yes.
And frankly, we've also been collaborating with 12 hospitals across
Right.
our region. So we've begun talking to our affiliates, our partners in our network, about load balancing. So more to come on that.
Okay.
And it's really about perhaps moving patients around to where the resources are available for them to be cared for.
And as we've talked about in the past, many transfers come into the medical center because we have things that we and only we can do.
Yes.
Sometimes in order to keep that mission open, to be able to do that, you have to take patients where they could be cared for in other hospitals and move them to those hospitals.
And that's going to be part of the discussion, Dennis.
That's right.
How do we move both ways?
Okay, so that does it for COVID today. We went through a period where we talked about only COVID, and then COVID became a kind of a lesser topic, but it's
Right.
certainly the number one topic again.
It is.
We would like to update on the union situation here, and as we talked about on the Tuesday video, there was a strike here on campus. We mentioned that on Tuesday, all activities here, clinical, education, and research, continued unabated. We were very proud of that and very proud of our workforce who came and took care of patients that day. How did it go Tuesday night? How did it go Wednesday?
Well, so Dennis, for the daytime on Tuesday, we actually saw almost 3,000 patients
Wow.
in our practices. We saw about 1,700 patients in our outpatient facilities here in the hospital.
Right.
I think the emergency department, those kinds of things. We admitted 145 patients and we discharged 145 patients. Kind of a normal day.
Normal, busy day.
We did 82 cases in the operating room,
Right.
and we delivered a bunch of babies.
That's fantastic.
So things went well overnight as well, and yesterday as well,
And today as well.
and today as well.
All right, very good. Well, I think it's important for those who watch the videos to know that care continued here, and I know many of you were participating in that, so we thank you very much. All right.
Dennis, a real shout out to the 400 plus nurses that came to work
Absolutely.
on Tuesday. That's why we were able to provide the care we did in a safe and effective way.
Between in the 24-hour period, I think that number came close to 500.
That's right, it did.
It's incredible. All right,
Thank
thank
you.
you. We will be back again on Tuesday. We know that our workforce, as always, will be working through the weekend, increasingly taking care of COVID patients,
Yes.
but other patients as well. We thank you. We'll be back again next week. We ask that you once again, please take care of yourself, take care of each other, and we'll see you on Tuesday.